We'll be starting in one. Okay. Hi.
Hello.
Hi, Kavita. Hi, Dhanalakshmi.
Hi. Hi,
Did you all have a good Onam?
Yeah. Yeah. We don't celebrate.
Nice.
But
We don't celebrate. Yeah, we don't celebrate, but we ate a lot of food on Onam.
Same here from neighbors and
Correct. So today, thank you for coming on this Sunday to join Dhanalakshmi and I. We have Kavita here, one of our very sweetest members, Mr. Yuvaraj, her daughter. Thank you so much, Kavita. And I have known the family almost like for over 5 years now. Kavita's father is one of the most sweet, temperamental person that we have ever met. Always smiling and chuckling at any joke, either that he's cracking or somebody else, and always quick to laugh, full of life, very, very gentle and kind and sweet. He has had Parkinson's for how many years now, Kavita?
he's been suffering from 2014.
Yeah, it's been a while, and recently it has gotten a bit worse. So we are here today to talk to Kavita to find out what are the unique challenges in being a caregiver for the caregiver. Because Kavita's mother, Yuvraj's wife, that is the primary caregiver. They all live in the same city, which is Chennai, but Kavita lives slightly away from them. So it's emotionally taxing for a daughter to watch her parents go through something as life changing as this. And she in turn goes through a lot of emotional heartache more than anything else in knowing how to support them. This is a very I feel this is a voice that we need to hear, where you're not the primary caregiver but you're supporting somebody in that position. So hence, what do you go through at times like this? So thank you so much for joining us today, Kavita. Really a pleasure to talk to you anytime, in fact.
It's my pleasure actually, and I'm so very happy and I thank Sudha and Dana for creating this platform where we can share our experiences so that everybody can benefit. Being a part of Parivadan has helped me so much during the past few months. Since both my parents have been affected with COVID, and especially my father, he's not back to normal yet, and being a part of this family has been wonderful.
Thank you, Kavita. I just want to know, is there a fan on? Because we're hearing like a buzzing sound when you talk. So yeah, I just want to make sure. Yeah. Pandring, yeah.
Just.
Are you also hearing that, Dana? There's like a zzz sound when she talks, no?
Is it better?
More than 50%, yes. Okay, so let us start with knowing a little bit about your family. Tell us a bit about your father. Like, how is Mr. Yuvaraj in his life? What was he doing? How is he as a person, as a father? Give us some background on Appa.
Yeah, we are a small 4-member family. My mom, dad, and my elder sister, and myself. My father is a very as you said, a very dynamic and vibrant person. He's a sportsman through and through. He used to play cricket in his college days, and he was called the college cricketer. He was so much interested in sports, and he's also a people's person, always going around and helping people. That was something typical about my father. You'll never find him at home. He'll be involved in so many activities, ex-Nora, this colony association of the colony where we stay, and a very, very caring husband and a very loving dad. He never used to say no to anything when we asked him, till he fell sick. That was when in 2014 he was diagnosed with Parkinson. Until then, he used to take my niece and drop her in the college for her exams. Very involved grandparent too. So we really miss him, and I feel that we have lost him since 2014. Slowly.
Is that when he was diagnosed, Kavita, in 2014?
Yeah. Actually, the symptoms started appearing way before that. My grandmother passed away in 2013. So the changes that we noticed were slowed reflexes while driving. Once or twice he met with mine. He's an excellent driver too. And once or twice he met with minor accidents. So we were wondering what is going wrong. And when I was traveling with him one day, I just noticed uh, this reflex, slow, like it slowed down so much that only after the vehicle passed, he used to swerve the car away from the path of the vehicle. It was delayed by a few seconds. The reaction was delayed by a few seconds. That was something I noticed. Gait changes we noticed. Weaving while walking. But my grandfather used to do that, so we didn't take it seriously. And uncontrolled hand movements. When he used to say no, he wasn't able to stop that hand movement. It'll just go on like this for some time. So we never related it to Parkinson at that point. And one more thing was misplaced emotions. He at my grandmother's funeral, he was very attached to my grandmother, but he was kind of laughing all the time. He didn't show that sorrow. So that was also something very, I felt not ordinary,
Yeah.
So then,
how old was Appa Kavita when he was diagnosed?
He was around 68.
Okay.
Yeah, 2014. Dr. Parani, neurologist, he diagnosed.
That must have been a shock to the family, no, to be diagnosed with some disorder like this.
Yeah, actually, that was the first time we heard about this disease, and we didn't know much about it. We didn't know that it was such a serious disease. One of my uncles also suffered, my father's atte's son. So later on, doctor told us that it could be genetic.
Yeah, it could be. Yeah, there's a lot of chance. Although there'll be genetic predisposition, not all of them go on to develop PD, but I think in Appa's case, he has. For how many years was he active after being diagnosed with PD? Like independently going out and things like that?
Actually, my father is suffering from Parkinson plus syndrome.
Exactly.
So it advances, very fast. Even recently, I was looking, this Google Photos keeps showing us photos from 5 years back, from 3 years back. My father was so different 5 years back.
Yeah.
Now he's just he's gone down drastically. So I can see that, this Parkinson plus syndrome is very, very progressive.
Yeah.
So since initially he used to go walking in the park in the morning, so very quickly he stopped doing that, and he'll be very dull in the mornings. He won't brush his teeth immediately after waking up. He was not like that before. He used to refuse to brush his teeth. I think movements are becoming difficult for him, and he used to feel a lot of dullness in the mornings. So we didn't start him on allopathy immediately. We were giving him Kapikachu Churnam from Ayurveda doctor, and oil massage with Ayurveda oils, and homeopathy. But then we slowly realized that that is not enough. You have to take the mainstay has to be allopathy, and maybe you can supplement it with these alternative therapies.
So since how long has he been having Syndopa then?
Syndopa maybe after 1 or 2 years only.
Recently, right? He just started recently.
Not recently. Actually, we again consulted another neurologist, Dr. Dhanraj. So he asked my dad to take Syndopa thrice a day, I think. But my mom started giving him once a day. Yeah, because Syndopa does create a lot of problems, and it is not, it's been said that it's not very effective for Parkinson plus patients. That also we noted. but we started giving him.
Yeah, okay. So for those who are watching, just to make a clarification, so Syndopa is like the main medicine for Parkinson's. And
Yes.
while it works very well for most people with affected by PD, it doesn't impact everybody. For some, there is very mild difference even once they take the tablet. So it is a discretion of the doctor and the member affected that they have to come up with the dosage that is most appropriate to them. But a lot of people have tried what you're saying, Kavita, where they do only allopathy for some time. Oh, sorry, they do only Ayurveda or homeopathy for some time and avoid allopathy tablets at all. So I think while people, we cannot discourage them from doing it, but I would personally say that you have to consider, as you were rightly saying, there is no way you can avoid allopathy medication. So whoever is watching it, so please keep in mind that at some point you have to come down to taking some form of Syndopa or any agonists for PD. Kavita, I also want to know that, tell me, who is the one mainly taking care of Appa?
My mom my mom is the primary caregiver, and she was independently all alone taking care of him. In spite of, my father gets hallucinations, very bad. That too started very as soon as he was diagnosed in 2014. Even from that time onwards, he's been having very bad hallucinations.
Like, describe the
Very
hallucinations.
scary hallucinations. Like, he used to say that there is somebody under the cot, a dog is dead under the cot and there's blood all over, and somebody is inside the room, somebody is standing there. He used to stare at one place, and he used to say there's somebody standing there. And some other kind of hallucinations also. Like, he used to say one day at 1 o'clock in the night, he said that there's something wrong with his, his genitals, that something is very wrong. And my mom had to rush him at 1 o'clock to the urologist. There's a urologist staying close by. My brother-in-law, my mom, and my sister rushed him to the urologist, and he checked and he said, there's nothing wrong. This is a hallucination.
Yeah.
So
this is quite terrible, because usually they tend to develop hallucination after a few years into PD, and a lot of times it is drug induced. But from what you're saying, you've never taken any drugs.
Definitely not drug induced.
Not drug induced. And in fact, doctors do say that hallucinations, Parkinson's itself causes hallucination, the disorder itself. So I think in Appa's case, because maybe it's Parkinson's plus, I think it's just in a very aggravated form since he was diagnosed with PD.
One thing is, this PD, it has two aspects. One is this mind problem, the other is this motor problem. My dad didn't have visible tremors at all, but he had these hallucinations. Very bad.
Exactly. Like, I remember the first time I met him, he was quite fine. He was walking, he was cracking jokes, and he was actually quite, what can I say, ambulatory and independent. He was going out and he was okay. Of course, you wouldn't go out of the house without your mom, but but apart from that, I think he was quite doing all right. But I think you were saying hallucinations were there from the beginning.
From the beginning. Yeah. Even before we started any of the medications.
Yeah.
He had, I clarified this with my mother yesterday, actually. She's the one who's been, seeing him from the beginning at very close things. So that's what she said. He's been having this from the beginning. And also he had a couple of falls, fell down from the staircase.
Yes.
Even before he was diagnosed. I just remember.
I think, Kavita, by the time you diagnosed him in 2014, my feeling is he's been already having symptoms of it even a couple of years before.
That's what I do think.
But see, in PD, they say that before 10 years or 8 years before it manifests physically, they start losing dopamine. And they lose like 70 to 80% by the time the physical manifestation happens. But I think the physical manifestation also happened earlier for Appa than he was diagnosed, is what I feel.
Yes.
Because as you said, he didn't have, sorry to interrupt, he didn't have the visible symptoms of tremor or things like that.
Yeah, correct.
I think that was like,
So that's the thing. That's why I'm sharing all this.
Yeah,
Any
yeah.
small changes we should never neglect. Our loved
Neglect.
ones, you know, there's
Exactly.
some small behavioral change or any change we should not neglect.
Neglect, especially
So,
what you said about your grandma passing away, you know, that,
mm,
and if we were so close. And we've had some members whose Parkinson's kind of came to the forefront after they have lost somebody close in their family. I think the symptoms
that's
were there
stress.
before, like mild symptoms were there before, but that will be attributed to old age or stress, or, you
Correct,
know, he's
correct.
going through something mentally right now. But when this tragedy in the family happens, but the symptoms just seem to aggravate overnight.
Yeah, yeah.
But a lot of people say because of the stress, because of the loss is why they developed PD. But I would say no, the symptoms manifested in a larger
Correct.
manner, but I think the disorder was already there. Yeah, I think so. That's what maybe must have happened to your dad.
That's very correct. Yeah.
No, yeah. How is your mother coping with all this? How is she dealing with this hallucination, him not able to walk, and his diet? How is Amma dealing with all this?
She's a very remarkable person, I should say. A very brave lady, because even I wouldn't have stayed alone with my father if I had, you know, seen these hallucinations. She didn't have any helper till a few months, till she was also affected with COVID. She was taking care of him all alone. And she dealt everything with a lot of presence of mind, and she's a very practical person. And I brought both of them to a meeting where I don't remember the doctor's name that Parivartan that you had arranged. He told us about how to, you know, mitigate all these hallucinations by changing the environment in the room. We followed a few of those things that he said, like we changed the curtains with bold patterns.
Mm.
Then we always used to keep a dim bulb, you know, light bulb, always switched on in the room
Mm.
in the night. And we removed all, you know, my mom used to have all these photos of gods and all on the cupboards. So my sister, she made her remove everything and keep it, you know, as plain as possible.
Did
That
that help?
helped. Yes, that helped.
To some extent, yeah, it does help. So
Yes.
Dr. Sridhar was the one who was saying you have to keep it clutter free. The house has to be clean and
Yes.
no like curtains swing, and you know that will
Correct.
cause some, yeah, that will trigger the hallucination for them.
Yeah.
True. So where do you live as against your parents? How far are you from your parents?
I'm around 15 kilometers away from them. My sister and my parents, they live in the same uh, compound, you know. My sister and she stay now. They are all staying together. Actually, she
I
is
want to
staying with
talk
them.
about how it was when both of them were affected by COVID. I think it was 2-3 months ago. I think.
Yeah, that was in March.
Take us through that journey, Kavita. What happened that time?
Yeah, my sister, actually, till the last year, my parents were staying alone in the house. My sister's house is just in front of my parents' house. They were staying alone. Then my mom was suffering from vertigo and she used to feel giddy at times. So it became a bit difficult for her to handle my dad alone, that anxiety and all that. Not that she was afraid or anything, but a lot of anxiety. So my sister brought both of them to her place. My brother-in-law passed away, so she was also alone with her daughter. So she brought both of them to her place. But the thing is, she had to go out to get things and all that. So she fell sick somewhere in the middle of March last year, and immediately my dad and my mom, both of them got tested COVID positive, and I think that was the worst time of my life. That was the worst time of my life because I could not go and see them. And my mom, she is very practical and she understands everything, but she just could not get a hold of what this COVID is and how it will, why I'm not able to go there. And once she said that water cupboard I have for my daughter,
Oh,
she was so stressed out, you know.
yeah.
Really, it pulled me down so much. Felt very bad. Then slowly everybody, all my relatives, my mom's brother and they all started telling her, if I go there and fall sick, then who will, all of them were sick at that time. My sister, my sister's daughter, my mom, my dad. So somebody has to be there to arrange things, to talk to the doctors and everything. So that was how I consoled myself that, okay, I'm out of the loop. So I'm able to help them.
Yeah.
That was very bad. And for the first 10 days, we knew that, hospitalization for a Parkinson patient is not going to be very helpful. Or, it's not going to be easy for them, that hospital setting and all that. So my mom, she was avoiding hospitalization for at least the first 8 days. Um, Slowly, my father had actually, even before Parkinson, before this COVID, my father had, he began losing capability to talk and swallow food. But still, my mom used to push in the food, lot of nutrition, lot of vegetables, lot of normal food, and to ease the, swallowing. Along with the meal, she'll give him one big jug of buttermilk. Somehow, I think that milk protein, it stops the irritation in the throat. Otherwise, he used to cough while taking the food. So we used to push in food. So he was maintaining his health to some extent. But immediately after this fever set in, it started going down and then it increased suddenly. Very high temperatures after the 7th day. So immediately when that high temperature set in, I think all the muscles started becoming very rigid. And he totally lost the capability to swallow food.
So
Yeah,
COVID aggravated all the PD symptoms.
All the symptoms.
Yeah. And how long was Appa in the hospital, Kavita?
We admitted him on March 25th. So he was in this Medway hospital at Trustpuram till April 2nd. So almost 9 days. So he was in the hospital. And I feel that, the caregivers in the hospital, nobody, they don't know what Parkinson's disease is. They just don't know. Even the doctors, even the junior doctors only used to attend to the patients. Nobody will go near a Parkinson patient, first of all. Even a normal, they were all hesitating. So all the junior doctors used to take turns and take care of the patients. And I don't know whether they really had an idea about this Parkinson disease and how the patient looks like a comatose patient only. They won't have any movements, very rigid. So I think they think that the mind also stops working. They don't know that the mind is there, very alert inside. Must have been very traumatic for my father. And thinking about all that, I still feel very, very, very bad. We should create an awareness about this disease and how. And another thing is, they used to give him this Ensure only. Nobody was allowed inside. Attenders were not allowed. We could not take food inside the hospital. We couldn't give any kanji, nothing. And when he was admitted, till the day he was admitted, he was swallowing food. We were feeding him, though he used to take an hour to eat. We used to patiently feed him, but who will have time in the hospital in that situation, to feed? So they put him on trials too. And since then he's been on trials tube feed, and they only used to give him Ensure morning a few times a day. That amount quantity of nutrition is not at all enough for a PD patient, I feel. And that must have weakened him even more. And when I went to see him after he turned out COVID negative, I don't know how to describe that experience. I looking at my father like that, totally like a rigid statue. No, nothing on his, no expressions on his face, just like a stone statue. I don't know what to say.
Yeah, it's heartbreaking, really. So any infection, when it affects a person with Parkinson's, it kind of aggravates Parkinson's symptoms. Even if you have like a common cold, flu, and you develop temperature, then it seems like you can't walk anymore, you can't talk anymore. A lot of members think PD has aggravated overnight. In fact, there's a huge underlying infection, and there's nothing much to say if it is COVID, because it is such an aggravated form of infection of virulent virus. So, and if the care is not proper in the hospital, but in fact, it's a protocol these days, Kavita, most of them give only Ensure. And the idea behind that is it has enough proteins to take care of the nutrition that the body needs. But what happens is they are left in isolation. Nobody's there to talk to them in a new environment. It's
And
very confusing for them. All that also matters a lot. So I think I've seen this over and over with members during COVID. Families have gone through such terrible times because you don't, number one, want them to be admitted and be away from your care. At the same time, you don't want to keep them in the house and lose out on the care that they need, ventilator support or oxygen support that one can't give at home. And I think you were lucky. In fact, this happened this March, not last March, and they were lucky to get a spot for your dad. Some of them, I think they couldn't even make it to a hospital amongst our members. So it's a terrible situation during COVID.
yeah, that's true.
I think there is no easy way out of it. There is no win-win situation. But what you say about hospitals is so right. They have no patience to understand the disorder. They don't know how to treat somebody with PD very differently from somebody with stroke. Technically, both of them just are lying on the bed. And not able to move, but it's a completely different ball game. It's a different disorder. So as you're saying, even when the doctors don't know, what can we expect from other medical professionals like nurses or other attenders there? It's a huge challenge. How is Appa's physical health now, Kavita?
Now he's been on this Riles to feed. Now we give him, actually, totally we can give around 2,500 to 3,000 ml of fluids a day. So I wonder why they didn't give that much in the hospital. They must be knowing that, just giving them 4 times a day or 3 times a day, 200 ml, that makes it only 1,000 ml, 1/3 of what can be given. But even though we give him now, every 2 hours we give him kanji. We make, we've ground, brown rice with nuts and dal. We roast everything. We made up powder. We make that kanji and filter it and give oats with egg white. Then we give him, then we boil rice, dal and all vegetables, including this varapu, varat and avaraka, all vegetables. We cook it together in the pressure cooker. We have to cook it very mushy, make it very mushy, so that when you grind it and sieve it, everything goes through the sieve. Most of the nutrients, the bulk goes through the sieve. So then we dilute it and give that at least thrice, so that entire quantity goes inside.
Nice. So there's a lot of effort that goes into this. And all of this is done by your mom?
My mom, now my sister has a help at home. We have a nurse also, because my mom is also suffering from a lot of post-COVID illness, urinary tract infection, diabetes and all that. She's not doing that well now. She's very weak, actually. So but she still supervises. She doesn't sleep also properly. She keeps an eye on the nurse all the time.
You have to. I mean, as good as the nurses are, I'm sure, but you have to keep an eye on.
In spite of that, something went wrong, and now my father has sustained a fracture in the hip bone and a dislocated joint also. In spite of so much of supervision and all that, I think the physiotherapist who comes, he didn't assess the strength. My father's going frail day by day because of this. And PD, in spite of the nutrition, for a normal person, maybe the weight would have been, maintained. But for a PD patient, it goes down due to this muscle thing, I think. So we haven't been able to stop that. Now he's so frail and he's like a skeleton now.
Yeah. He looks very different from what he was even like 4 or 5 years ago. I know. So I think that's also very hard to digest, to see your father like that, I
Yeah,
think fathers are always like such hero figures in our lives.
correct.
And to see them like a child, I think is very heartbreaking.
Yeah.
Yeah.
Still, he does emote when we go and stand near him. You know, he'll
Mm.
open his eyes wide,
Yes.
and sometimes he'll take my hand and kiss me.
Yes.
He does all that still.
Yeah. Yeah.
Terrible. Yeah.
Yeah.
We've been
So,
trying to keep him as comfortable as possible.
yes.
That's the best I
That's
think.
the best one can do right now, right? Exactly.
Yeah.
Tell me something about you now, Kavita, in terms of how is it for you? Because it's if you are there right next to your parents, like how your sister is or your mother is, so at least there's some active involvement, so at least there's a sense of satisfaction. Oh, I'm making a feed for him. Oh, I'm changing his diaper, or
Yes.
I'm just sitting next to him, even if not anything else. So there is a tangible sense of worth of your time. So you are
That's
not
very
far away, like sitting in the US like some kids are, which is again mind-bogglingly crazy to be
yes.
that far
Yes.
away. You are still in Chennai, but how is it for you to be? It's like you're watching your parents and your sister do this. It's like watching through a glass door. You can see them, but you really can't touch them
Yeah.
sometimes. How is it for you?
It's very, very, very depressing. It's terrible. My mind will always be there, even though I'm here. Physically, I'm at home,
It-
but my mind all the time it is with my father and my mother. It's extremely difficult to do this secondary care of what you want
Whatever
to
it's called,
call it.
right? Yeah, yeah.
Yeah, it's even though I try to do everything, whatever my mom says, even she'll call me sometime. This is our only outlet, you know. She'll call me 10 to 15 times a day. I
Abba.
always make myself available, but still that feeling of I don't know whether it is uselessness or some kind of an emptiness will always be there.
Yeah,
But the moment I go there, I'll start feeling better, definitely. And
exactly.
as you said, when I am there with them, I'll feel 100 times better. Even though I'm going to leave my son and my husband and go there, I feel very happy. I feel happier there, being there and doing things for them
Yeah.
than staying away like this far away. It is emotionally very. It takes a toll on your mind. It causes a lot of anxiety
Yeah.
and makes you feel worthless.
Yeah. It's a very
Though
helpless
you
feeling.
know I know I am doing my best. Still, there is that feeling.
Exactly.
Yeah.
Tell me one thing. For your mom or for your sister, what is like their biggest concern when they come to you?
My mom, she wants me to be there with her.
Ah,
That is her the first. She
okay.
knows the demands
Yeah.
at home. My in-laws are also
Mm,
old. You know, my father-in-law also was affected with COVID.
mm, mm,
So they are also recovering. Though I'm not staying with them, but
mhm,
I have to, like how I take care of my parents, I have to
mm.
take care of them too. That is what my mom, you know. And next week, thing that problem they're facing is with these nurses.
Yeah.
Is
Yeah.
finding good nurse. We've changed so many nurses in the past 4 or 5. We have changed.
My
And
God.
pardon? Sorry.
In 4 or 5 weeks, you have
Yes.
changed a lot of nurses?
No. In the past 4 months,
Four
we've
months.
changed. For the first 2 months, we had an excellent person.
Uh-huh.
It's all our luck, I think.
Mm,
Then we started, that girl left, and it's been very tough for my mom and my sister. And also for my mother, my father has been a very good husband, and
mm.
they've been together for so many years. So she's still not able to take in the fact that my father is not going to get, I don't know whether he will get better, but she still thinks that, oh, she always tells this, what can we do to make him sit and have his food again? You find out, you talk to this doctor, you talk to that doctor, you talk to the Ayurveda doctor. She that's why, we got this physiotherapist, and every day she used to tell him, you bring him out and make him sit in the wheelchair for some time. I think that's when the hip got dislocated.
Yeah, I know. I think his body got too rigid and the bone density reduced, and something went wrong in handling that it just cracked.
Yes, yes,
It's as simple as that and as painful as that,
yes.
It's a totally unavoidable problem, but given the situation, it just happened. I think
Yeah.
as caregivers, I think if we were all in your mother's position, I think the biggest problem I have seen is just accepting the disorder,
Yes, correct.
because this is a
She's not been
progressive.
able to do that.
No, and it's a progressive disorder, and I'm sure I would be the same in her place, because when it progresses, we'll keep our expectations low, but there are still expectations. Like, for instance, we would say things like, if he just sits, I'll be okay. If he was just like last month, also I'll be okay. We are not even thinking of pre PD, we are only
Yeah,
thinking, oh, at least
exactly.
last month he was eating, now he's not even eating. At least last
Exactly.
week he opened his eyes, now he's not opening his eyes. So at least that we cling on to every small thing as if our life depends on it, and which in some weird way it does, I think,
Yeah,
my God, and
exactly.
each day it
You
only gets
described it
worse, and
very
we're
well.
only thinking of the better a week ago how it was.
Mhm.
Yeah, and I
Yeah,
think it's
that's what
and
my
and
mom always tells.
and how would you tell your mother that, look, it's only going to get worse, or this is all it's going to be? You can't say that.
I cannot dare to say
Yeah,
such a thing to my
yeah,
mom.
exactly. And maybe that's
She
not
has
true.
pinned
Maybe he'll
her
get better.
hope on that. She still
Yeah,
thinks that he's going to.
yeah, get
She
better.
tells me when he gets slightly better and starts eating,
Mhm, mhm.
he starts taking food through the mouth, I'll take him back to my house.
Ah,
He's still having that hope,
yeah,
and I
exactly.
just can't destroy that.
Exactly.
Now
And why
I
should
don't
you,
have the
right?
heart to.
Yeah, and you shouldn't. You're doing the right thing. You should just say, yeah, okay. And you never know, maybe he will, maybe he won't. Who are we to say he will? Absolutely
Correct,
not.
correct.
Right?
My sister is, she was more attached to my father. Both of us are, but my father had a soft corner for my sister always.
Mhm.
And she is also totally devastated by what happened. And she was the one who brought the infection home. So
Ah, for the COVID,
she
yeah.
is feeling very bad, and she kinds of she does everything for them. Now she's no arranged attender and a cook so that my mom doesn't have to do any work and all that, but she's not able to face my father and come near him and give him the any
Yeah.
much support. She just stays a bit in the background only.
Yeah. I think
She's
it's
taking
just
it like that.
heartbreaking. Yeah. Yeah. I think it's guilt, no, Kavita? Whether you do, you feel guilty. And
Yes.
and you know what ends up happening in caregiving, which I've noticed is, as caregivers, we all tend to make mistakes. Either in what medicines we give, or what food, or how even like this fracture that you're just talking about. See, your mother was thinking the best for him, so mobilize him, make him sit in the wheelchair, whatever. And I'm sure the physiotherapist was doing a good job, but given his bodily condition, given where he was, there was a slight mis judgment somewhere. And then this happens, and we'll all feel guilty. We're like, oh, I shouldn't have
Correct.
mobilized him. Oh, I should have known his body like this differently. I think as a
Yeah.
caregiver, whether you're actively caregiving or not, one is just constantly burdened with guilt. I think either we have done it wrong, or we have not done enough, or we just don't
Yeah.
know what to do. But this
Correct.
guilt is just enormous. Yeah.
Yeah. That's very true.
Yeah.
Also.
Yeah. Yeah. My goodness. Tell me, Kavita, how is your family support? I mean, you're on live, and then you can't like say anything, but are you getting enough support from your immediate family to take care of your
Yes.
dad?
Yes. Definitely. My husband. He's always ready to send me. He never hesitates the moment I say I have to go. Like
Yeah.
whenever my father's BP shot up suddenly last week and he was sweating. So
Mhm.
my mom will immediately call me and she'll tell, you have to come immediately. So I leave them and go. So my son now he's learning cooking, little bit of cooking, and somehow they manage. So
Okay.
they very, very,
Yeah,
very.
very adjusting.
Yeah.
I want to ask you something which can sound a bit controversial. See, from when your mom calls you, like you are her outlet, right? She definitely wants you next to her, and she's going through this so much anxiety, and you girls are the only ones she can reach out to who will understand her anxiety better than others. But when you get these constant phone calls, like 10 phone calls, 15 phone calls a day, what is it doing to your mental health?
Actually, only I feel better attending those phone
You
calls.
do.
I feel
Okay.
better because I feel that's something that's what I can do being where I am in what the position I am. That's the
Okay.
most I can do for my mom and dad, and they've done so much for me. And so this is nothing. That's what I feel.
Okay.
I
So,
don't
oh, that is great to hear.
feel
So you're not sitting and thinking, oh my God, another phone call. What is she
no,
going to say? I don't have, that's not what you're feeling at all. You're just
no.
saying, okay, if she wants to talk to me, if she wants to get my advice, this is the least I can do. Okay, call
I
me.
can do. Yeah. I
Call me as
always
many
keep my
times.
phone around me so that I can, I feel very happy to do this.
Okay.
I don't feel
Okay. You
any,
don't feel
because I'm,
overwhelmed or burdened by it.
no, no, I don't
Okay.
feel overwhelmed at all.
Oh, that's very, very good to know. I don't know how many would feel like you. I don't know if I would feel like you, but yeah, but I definitely understand your emotion behind it when you say, this is the least I can do.
Yeah,
Fair enough.
being
Fair
in
enough.
the, because I can't totally leave my home and go there.
Mhm.
That's what will make my mom most happy, but I cannot do that. My sister is there, but as I told you, she too, takes she's taking treatment for depression and she's not doing that good. So
Yeah, she's had a
she cannot be.
personal loss, as you said. She
Yes,
just
yes.
lost her husband recently.
Yeah. So that emotional involvement, she's not able to
Ah.
give that emotional involvement.
Yeah,
That is
as you
all
said,
that.
she's arranging for a nurse, she's arranging for a
Yeah, yeah.
physio,
She
she
takes
does all the
other,
logistics.
yes, getting
Right.
medicines
Mm.
and all that she takes care. But other things like arranging that we've shared our duties.
Yeah.
So other things, when I go there, when the doctor visits, I go there, I get
Mm.
the reports, I talk to the doctors and things like that. Like I'm in the support group, I
Yes.
interact and all that. So my
Yeah,
sisters are
I
somewhat
don't
in
think
the
I've seen your
background.
sister. Yeah, yeah, I don't think I have. Maybe once when I visited them, but not really.
Yeah.
Yeah. Yeah. What do you do? I think this is actually a favorite question of Dhanlakshmi's, but I'm just stealing her question. What do you normally do, Kavita, just to keep your sanity? Do you do anything that is, because you have multiple responsibilities as a mother, as a wife, daughter-in-law, daughter, and
The
all of them
first,
equally important and taxing. What do you do for yourself?
yeah, I think we should do something that we like. So now I have started, getting some potted plants, little bit of gardening. Then I just like to try out new recipes. So definitely in the afternoons when I find time, I just look at a few YouTube videos. Um, I divert my mind like that, and I think when we start doing work, some activity, physical activities, also mind gets diverted. Then it'll come back to the same problem, but then at least, yeah,
That's like Shruti behind your head. It'll always be playing, you know,
yeah,
that will never go away. Uh,
never.
for momentarily, you'll be distracted, but it'll
Correct.
always come back to that.
Reading, I read books, and I realize, that I have realized that okay, this thing is affecting me, and I do need help, and I do need to get out of it. I am getting depressed. It's not easy. I am getting depressed.
Right.
Um, but then I am trying to come out of it.
Yes.
I know that I have to. So I'm
Yeah.
pulling myself out of it.
Yeah. And
You need to make that effort, take that time and that effort to pull yourself out. And this it can really, drown you.
absolutely. Because, it's like one deep feeling within you that's just constantly heavy on your heart.
Yeah.
It just doesn't go away.
Correct.
Yeah.
And I spoke to a counselor once,
Mhm.
and she shared some experiences. I spoke to Dr. Prabha
Mhm.
and Radhika, and we are all
Oh,
sailing in the same boat. So we see the pain of others.
Yeah.
That too, yeah, we are not the only ones who are suffering. There are so many like us.
Exactly.
Yeah.
So many children living far away from parents,
Far away. Yeah.
living in the US and trying to manage like a caregiver from there, trying to arrange a physio from the US. It's really heartbreaking.
Yeah. So it's terrible. Another friend of mine who recently joined Parivartan, her husband is also suffering from young onset TB. So seeing all that, I think we have to count our blessings and move on.
Yeah, and try to be of some help to others, right? Like there is another caregiver in your same situation. I'm sure you would reach out to her and talk to her as to how you dealt with
That also
Appa.
helps a lot.
A lot, right? Yeah. So when you go through something as intense and personal as this, tomorrow if somebody is saying my father or my husband has constipation or hallucinations, you would be in a better position to guide them,
Correct.
tell them what you did, what worked for you and what didn't.
Yeah.
And
That's
you're
why,
still
yeah, this Parivartan has been a very
yes, I think it is a strong bond among members, I think.
correct.
This journey is still going to go on for you for some more time, Kavita, but tell me, like from the beginning, say from 2014 to now, I'm sure along with Appa's Parkinson's, your emotional maturity or quotient level also must have increased over years. If you have to say, okay, this is something that I was not before, and I learned this now. What is it that's something that has changed you fundamentally, if there has anything in these years?
Um, I have learned a lot. I think looking at my mom and my dad, the bonding between them, how my mom takes care of my father, and actually, I always have been feeling, that as I told you in the beginning, the my since my father's been diagnosed with this PD, we've been slowly losing him, and maybe if he was taken away from us suddenly, that would have been another kind of trauma. We were all very closely knit. So we've been slowly losing him, and it's opened my eyes, and I've been learning to, let go of things.
Yes, yes, yes.
Yeah, I
Well
think
said.
we should all learn to let go.
Let go. That's a great thing you said, Kavita. Because I want to little bit touch upon something that I hear very often. Whenever somebody is taken to bed, or whenever they are compromised on their independence and mobility, other families would look and say, oh, thank God, my husband or my uncle, he had a sudden heart attack, he passed away. Thank God he didn't suffer. So thank God he didn't suffer. Thank God he didn't suffer. You hear it so much. And for the families who are actually in the process of that quote unquote suffering, it's almost like slap on the face when somebody says, unlike your father, my father didn't suffer, then it makes me and us wonder, was it suffering? Was it good? Was it not good? Is it bad to go through this as against dying suddenly? You are echoing my words when you say this gives you a chance and time to be with them.
Correct.
Although as sad as it is, then losing, see, both are two different kind of trauma, right? To suddenly lose them is a trauma. To slowly see them deteriorate, not be the father that he was, is another trauma. So I don't know which is better, which is worse. It is only what it is.
Correct.
Um, and it's a very controversial and a very twisted thing that when I say that at least I had the opportunity to serve my father. You love him so much, you're so fond of him, so at least though I could do this, so I've done this for him. See, although the physical pain is his, not yours, but there is so much love in taking care. Somehow, and there's also a lot of pain, not because we are in pain, because we watch their pain and feel bad for them. But if all of life is about never suffering and no pain, I don't think that world exists. So when people say, oh, thank God he didn't suffer, I'm like, a lot of people are healthy. like in the way that they define health. They can walk, they can eat, but they create a lot of problems around their circumstances. They create fights, they create a lot of disruption, or they might be complete wastrels. But in our eyesight, they are not suffering. But a bedridden father should not be there. Somehow we have to
Very
negate,
well said.
you can be whatever, you can be a burden to the society, but you cannot be ill and be bedridden. Then that is suffering and that should not happen. I don't know. I disagree with that. So I constantly struggle
It's
with
a
it
very
when people,
beautiful thing you said, Sudha.
yeah, I borrowed it from somebody
Been
actually. One of the
hearing
caregivers
this,
told me this.
so much, as you
Exactly.
said, from relatives and from that, oh, he's suffering so much. And as you said, my father, he passed away like this. And
What do you
uh,
tell them? Then I only tell them, good for you. I mean, you can't explain all of this to everybody. But then you question yourself thinking, okay, is my family suffering more than other families? Maybe yes, maybe no. I don't know. But it is what
maybe
it
in
is.
different ways, everybody suffers.
Exactly.
And
Suffers, whenever, okay, whenever it is a bodily suffering and a health-wise suffering, people wash their hands off.
yeah,
But if somebody is really struggling to make a living, really struggling to get by, somehow that struggle is okay.
correct, correct.
I don't
That's
know.
very, very,
Uh, you know,
uh,
and we all suffer mentally, no, Kavita. There could be a lot of work stress. There could be a lot of stress with children. There is suffering in a lot of ways. This is just one of those. Uh, you know, I don't think we have a say in what we go through. Whatever we go through, we go through. I mean, there's no judgment call on is this better or is that better. It
yeah,
is what
yeah,
it is. So you can't wish for your father to pass away or not at all suffer so that everybody is, at peace. That's also not a solution.
correct. So
Yeah. And I'm really
that's
happy you
a
said that
very
about letting
beautiful
go.
thought. Yeah,
Yeah, and letting go is so important, as you said, and to accept. This
yeah,
teaches you a lot of acceptance in life, I think.
correct. That's what this
Yeah.
journey has really helped all my mom,
Yeah.
my sister, and me.
Yeah.
It has taught us that this slow way in which we have been losing our father. I feel it's teaching us to, let go and not be so possessive. Yeah,
Yeah. Then life takes a totally different perspective, no? Comparing everything from that angle. One of the members was saying, who has PD. I was like, sir, what did you learn? He said, now everything seems okay to me. Work problem, this problem. In front of PD, everything seems very small. In fact, he said it on one of the lives. I forget who said that. He said, "Ellame ipo okay ah irukuma." Nothing seems too bothersome anymore.
difficult. Yeah,
Yeah.
that's also something nice. Yeah.
Uh, I always ask this. Okay, Dana, do you have? Because I stole your question. Then I'm sorry. Do you have something to ask, Kavita? Then I
No
say no.
questions.
Leave me alone. Okay, Kavita. What if you have to describe, like, say, in 2 or 3 words? How has it been for you to watch your parents go through this? What words come to your mind?
It's been traumatic, terrible.
Yeah,
Yeah.
true. Yeah,
As
it
I
is
said, it's been the worst time of my life. Never seen anything like this.
true. True.
To see loved ones, go through so much pain,
Yeah,
and it destroys us.
it does. Right. I think something fundamentally in us changes once we see our parents go through what we are going through.
Yeah.
Yeah, it is hard. Um, this sounds rather somber to end the meeting like this, but I do want to say that as much as we have spoken about Yuvraj sir like this, I have never seen him when he was not smiling or laughing. See, all this anxiety, this pain, all that Kavita is talking about, how mother is feeling, at sir's worst points of hallucinations, or at the worst times when he couldn't walk and I've seen him, he was still laughing and smiling for the smallest of small things. I don't know how sir managed to be like that. So, I think the spirit of him is always so light. and so wonderful. Whenever I think of sir, I always think of how cheerful he was, irrespective of anything. I think, he's blessed to have kids like you, and you're really lucky to have a father like that.
Thank you, Sudha. Thank you so much. You described my father very beautifully. I don't know. Thank you so much.
Amazing soul. He's just really an amazing
He's a
soul.
very positive person.
Yeah,
Just
very
having him in the
positive,
room,
yes.
even in this
Yeah.
condition, makes us feel good.
Yeah. Exactly. You said it. In whatever way he is, he's still able to give joy. So I think that life is well lived, even if it is on bed giving joy to family. You know what I mean?
Correct.
Yeah. He's so, people say things like be positive, but literally he was always positive.
Positive.
I mean, this is
Yes.
not even an
You
exaggeration
can
when I
feel
say
that
this,
around him,
Yes.
even
Yes.
now.
Yeah. Some people are hale and healthy, but mentally they can just completely pull you down with their negativity.
Correct.
But
correct.
not so, amazing soul. And what an amazing family. It is so wonderful to see everybody come together, stand up to the occasion, and then do something for it. I think there is only love here, although mixed with a lot of personal anxiety right now. And there's such warmth and affection in this. So kudos to all of you. Great job
Thank
done,
you.
Kavita.
Thank you, Sudha.
Thank
Thanks
you, everybody,
for all the
for joining.
support, Sudha and Danu.
Thank you.
Thank you.
I'll stop the live now.